Thank you, Governor. So no sector of our society has been immune to the impacts of this public health crisis. And one area that I'm primarily responsible for in the governor's cabinet is behavioral health, so supporting those Ohioans with mental illness and with addiction issues. This system has been taxed heavily in recent years already, taxed in terms of stress that they're experiencing and meeting the needs of Ohioans with these conditions. And so this behavioral health system is what we're making every effort to support. This week, the governor looked to my team at the Ohio Department of Mental Health and Addiction Services, we also call it MHAS, and the Recovery Ohio team with Alicia Nelson and her leadership, and the many other agencies who work to make sure mental health and addiction needs are met for Ohioans. As you know, a few days ago, I executed an order that discontinued in-person visitation of patients in the state's 6 psychiatric hospitals that we operate at the state level. We've made every effort to ensure that there's continued telephone contact between patients and their visitors, and we're working to make sure that there's video visitation available as well. And as we continue to look at this crisis and its impacts on those who struggle with substance use and mental health conditions, we want to announce the following today. In partnership with the Ohio Department of Medicaid, we are filing emergency rules to expand telehealth options for individuals struggling with mental health and substance use disorders. These new rules will allow complete geographic coverage of telehealth services throughout the state of Ohio in every home through just a simple landline. This is important because we know that broadband and cellular service aren't available in every community, and this, in fact, is something that the Lieutenant Governor has been taking on in our state. This also eliminates the need for special equipment to connect through video conferencing. So now these actions will allow professionals and their patients to use normal cell phones and applications like FaceTime to connect through video conferencing in order to receive the services they need to continue in their mental health and addiction recovery. It also allows us to eliminate the requirement that a person be seen for their first appointment in person with a professional. And so if that person hasn't, if an Ohioan hasn't had a mental health or addiction issue or sought treatment for that in the past, and they want to do so now during this emergency order, they will be able to have that first appointment through telehealth rather than needing to be seen in person for that care. These are important actions for us to take to make sure that people can still get the mental health and addiction services that they need, so that we're protecting the patients from potential exposure and the workforce from potential exposure. This is really intended to keep everyone healthy in all ways, not just physically, but mentally and emotionally as well. And we're also committed to everything that we can do to make sure that those struggling with these disorders are able to access the medications that they need. So last night, the Federal Substance Abuse and Mental Health Services Administration approved Ohio's COVID-19 opioid treatment plan. These plans were distributed yesterday to our community treatment partners in the state. And the organizations that I'm talking about offer important addiction treatment, which involves medication, psychological therapy, and other recovery and counseling services. Their continued operation is essential to our state, its citizens, and to our commitment to supporting people affected by the opioid crisis. So specifically, the plan includes opportunities for them to work differently in the regulatory structure to respond to the needs of the patients that they're seeing today and the experiences they're having today. These critical providers are getting guidance on how to manage their operations to reduce risk of exposure for patients and staff, and guidance on how to make sure medication is available to those Ohioans who are unable to come to a treatment center now because of the risk that they may have COVID-19, but they will be able to get the medication in their homes. My agency also understands the importance of access to medications through all of the treatment providers and state facilities, not just the ones talked about in this federal guidance. And so our Ohio Pharmacy Services, operated by our department, has worked over the past several weeks to ensure that we have adequate and sustained supplies of medications needed in the state's facilities and for our community partners that access these stores. Our every intention is to make sure that medications are available for people with behavioral health and addiction issues and the other medications that they need for their care in our institutions. So I just want to take a minute and say to all of our friends and families living with mental illness and substance use disorders that it's important to know that we want you to stay healthy and well in all ways, to continue in your recovery, and to follow the instructions that we're setting forward, and to know that if you have a mental health need or an addiction services need, we're making every effort to make sure your access to those services are in place. We are asking that if you're not healthy, if you're experiencing the symptoms that Dr. Acton and her team are communicating, that you should be working with your healthcare provider, your local health department, and ensuring whether or not it's safe to go to treatment. Call your treatment provider first. Figure out how to get the services you need in your home if you shouldn't be going to the treatment center. But also, don't skip appointments because you're afraid of exposure. We want you to get the counseling and other services that you need. We want you to stay healthy and well in all ways. If you have any questions or concerns, please call the ODH hotline that's been set up and ask. Call 1-833-4ASK-ODH in order to get the individualized questions that you have answered for you and your family members in accessing health care and mental health and addiction care as well. It's everything that, we're doing everything that we can to heighten the increased anxiety and stress that people are feeling too. So I want to talk about that a little bit as well. You know, these are, as the governor and Dr. Acton have communicated so ably over the past several weeks, these are really trying times for all of us, professionally, with our civic duty to one another, and then personally in our own homes with our own families. We're all experiencing new stress, new anxieties, some grief as well, right? So I just know within my own home there are plans that we had for this week that we are not following through on, spring break plans. My daughter was really looking forward to launching her senior season of softball this week with her teammates, and that's on hold. So we're all dealing with a new way of living that is temporary but is really impacting us in very personal ways. So I want to share some things that our team, mental health and addiction professionals, have put in place, and to remind you of what we can do to help ourselves feel in control of information and to help manage our anxiety and stress. The first thing is to just reinforce that getting information from a trusted resource is the most important thing. You have to be going to the ODH website, coronavirus.ohio.gov, and if you have individual questions, use the number 1-833-427-5634 in order to get those questions answered. Those are the best sources of information that we can offer in Ohio and are offering in Ohio, and we want you to use those. We'd also urge you to limit your media exposure. We want the right amount of information so that we can feel informed, and no offense to my local media partners that are all here in the room, but it can be overwhelming to saturate ourselves with stories about everything that's happening in the world on a minute-to-minute basis. And so plan time to catch up and stay informed, but also plan time to step away from it so that you can participate in your normal life activities and not overwhelm yourself in information in an unhealthy way. Also, keep doing the things you always do to reduce your stress and feel better. I mean, we all have strategies that we use. Sleeping, eating healthy foods, resting, relaxing with family and friends, watching movies, taking walks or exercising, staying hydrated. These are all things that we should continue to do. We may need to do them a little differently than we've done them in the past, but for a limited period of time, we need to continue doing them so that we can make sure we're staying healthy and well in our emotions too, and just reducing that stress. Also, pay attention to signs of stress in yourself and in your family and friends, right? We know what signs of stress are, but we may not recognize them while we're having them immediately, or we may recognize them a little down the road. But if you find yourself worrying a lot or having thoughts that you just can't get rid of over a prolonged period of time, so maybe a couple of days, that's time that you could reach out to talk to a friend for support or to talk to a professional for support. If you're eating too little or too much, if you're sleeping too little or too much, these are things that are signs of anxiety and stress. And so know those, monitor those, take a break, do something that's healthy for you and your family. If you're increasing your arguments with families or friends or feeling a little more edgy with people, those are other signs. More serious signs, if you're feeling helpless or hopeless, those are times you should reach out quickly for help. We don't want you to feel helpless and hopeless and have thoughts of hurting yourself or someone else. So these are times where you can reach out and get help for stress management as well. And oftentimes when people are feeling increased anxiety and stress, they'll turn to using alcohol or drugs or other substances more to help manage some of that anxiety and escape a little bit. That's another sign that you're not headed in the right direction with stress and anxiety management. So we're saying if you see that increasing for yourself or a family member, do other things for stress management and reach out for help if you need. We've provided the ODH helpline with information about where you can get resources for mental health and addiction services, and so you can call that number. They've got fact sheets on what you can do and who you can connect to at the national or local level for any of the services that you need. Thank you.